Welcome to Raise the Line with Osmosis from Elsevier, seeking solutions with leading experts on how to increase healthcare capacity so people can get the care they need during the pandemic and beyond.
Hi, I'm Shiv Gaglani. As I've said many times when interviewing a rare disease patient or their loved ones, they could easily be mistaken for medical experts because they've had to do a deep dive into whatever the condition is, especially because there is often a lack of knowledge in the provider community about it. That's why I'm delighted to welcome Dr. Mark Korson to Raise the Line today, because he is a strong advocate for patients participating actively in teaching the medical provider community. Dr. Korson is a metabolic geneticist who spent over 2 decades leading work in that specialty at Boston Children's Hospital and Tufts Medical Center. In 2017, he joined VMP Genetics as Director of Education and Physician Support Services, providing remote consultative assistance to clinicians at 10 major academic medical centers caring for patients with proven or suspected metabolic disease. His work at VMP also includes directing the Patient-Teacher Registry and Patient-Teacher Video Catalog. In the rare disease space, he's on the board of the New England Regional Genetics Network and is a founding board member of Rare New England. I had the pleasure of connecting with Dr. Korson recently to learn about his work in medical education and the rare disease space. And before we get started, I'd like to give a shout out to Dr. Tom and Maria Rebecci, who were the ones who first introduced me to Mark. So Mark, thanks for taking the time to be with us today.
Well, glad to be here.
Well, as we often like to start for our audience of current and future healthcare professionals, can you give them a bit of your background? What got you interested in a career in medicine and then specifically in genetics and metabolic diseases?
Well, I think actually my parents wanted me to go into law, but when I did an internship in a law practice, I really didn't like it. I actually thought, I don't want to take this much responsibility in court and because of the way I speak or don't speak well, someone's future is going to be impacted. So I went into medicine where life responsibility, where you're responsible for somebody's life. But the difference is in law, you're in an adversarial relationship with someone else. But in medicine, all the caregivers are on the same team. Well, that's okay. I mean, and the adversary is disease. Oh, I'm okay with that. And I like the detective work in medicine. I like the interaction with patients, the continuity with families. It's an incredible privilege to be part of the drama of people's lives. That is very personal. It's so close. It's so human that it is. That has been the big prize for me, and it's taught me amazing lessons. It's taught me. It's helped me prioritize things in my own life. What's important and what's not. It's taught me don't be judgmental. Everybody has pain in their lives, and if someone looks like they have an easy life, well, you just don't know them well enough, or their lives. So medicine offered so much of that. And of course, I worked at camp for years, so pediatrics was, the the best portal to get into medicine. But it was in my second year of pediatrics where there was a little girl. She was about 2. This was in Toronto, and she developed a metabolic acidosis. So the acid level in her blood rose. And the first thing you think of was this could be an infection. So I was writing the orders for blood culture, urine culture, and writing antibiotics. But then I thought, I don't know I don't have an idea of where to go if this isn't an infection. So I left Toronto for a month and went to Children's Hospital in Boston and did an elective in metabolism. And seeing the practice there, it's a very multidisciplinary clinic. I fell in love with it. And so 2 years later, I actually went back to do formal training in that area. So I'm pediatrician with a focus in metabolic genetics.
Well, that's incredibly well spoken, and certainly I think you're a great advocate for people going into the career of medicine, and specifically, I think, metabolic disease and pediatrics. And actually, before we get into the work you've done in teaching and rare disease, I did want to, as an aside, let you talk a bit about kind of how passionate you are about getting people into the field of metabolic and genetic disease. I know the fellowship we talked about. Do you mind telling our audience a bit about that? Because I know several of them will probably be very interested in following you and VMP Genetics as a result.
Oh, well, genetics is sort of the way of the future. It's impacting every single aspect of medicine. Biochemical or metabolic genetics is actually one part of genetics which is dealing with the biochemistry. So there's some sort of chemical imbalance where something is present in too great concentration, something is deficient, and either one of those scenarios can cause symptoms. And so once you know that, there's an automatic approach, there's an automatic way of thinking about how to treat that. You either bring down what's accumulated or supplement. And that's the beauty of biochemical genetics, because there are innumerable ways of treating the patient. These are lifelong diseases, so you get to follow patients over time. It's brought me lots of opportunities to interact with a lot of people, not just in the hospital, but also colleagues from around the country. It's a rather small community, so you get to know a lot of people elsewhere. I've spoken at state legislatures advocating for insurance mandates to cover some of the products that we prescribe. I've directed a PKU camp for a number of summers, and you see people patients in a very different context. Right now, I direct co-direct the North American Metabolic Academy, which for 14 years now, we've run a boot camp for genetic trainees. And it's a wonderful opportunity to get all these genetic trainees together for a week. And yeah, we learn a lot, but we have all kinds of fun. We make up songs around the disorders. Everyone is required to write a haiku. There's a talent show. There's a metabolic Jeopardy at the end of the week. It's sort of like camp, and people love it, and people want to come back. So if you're interested in biochemical genetics, you have a seat. You have a place at the academy.
That's awesome. That's really great to hear that. And I definitely will link out on the show notes so they can learn more. I will say it's funny you mentioned the song and the haiku because as you know, this year Osmosis and Elsevier launched the Year of the Zebra and are doing a lot around rare disease education. Largely, this is one of the reasons you and many other guests have been on the podcast. And one of the things I've been talking to our producer Michael about is ChatGPT. I don't know if you're familiar with it. It's from this company called OpenAI that it's probably one of the leaders in artificial intelligence. And I actually have had it write out a song and a haiku and a different poem and a children's book about rare diseases. So I'll have to share with you the link. It's just chat.openai.com, and you can just ask it to do something like that, and it'll write something and give you some creative ideas around it.
Oh, okay. Well, okay. So there I was invited to give the board review lectures on metabolism to the National Society of Genetic Counselors. This was about 15 years ago. And what I realized when I got there is many of these genetic counseling students actually had never had a metabolic. They were in centers where metabolism wasn't very strong. So their introduction to metabolic disease, this whole area of genetics, was at their board review course. So the tension was exceedingly high. And what I learned in that situation is find ways to break the tension in the room. So right in the middle of lectures, I would break into a song or tell a story or read a poem. And I'll sing you a song right now that I wrote back during my pediatric residency. It's not specific for genetics or rare disease, but nevertheless, it tells a story. And it goes like this. CBCBDRLGIGUGC, MSU4C and S and PTPTT, PVCs on EKG, S1, S2, S3, an IV with some KCl right down here if you please. CVP and JVP, an IVP done stat. When you want a chest X-ray, write down PA and LAT. But if you should get sick one day, you'd better hope and pray your MD knows her ABCs or you'll be DOA.
Amazing. We've done over 350 episodes of Raised Line. We've never had a guest sing a song, and let alone one that is a great way to learn medicine. So that's awesome. Thank you for sharing that, Mark.
You're very welcome.
And since you shared that with me, I mean, I will share this with you because I think you'll find it really fascinating, because we're going to be using this at Osmosis increasingly, and for the Zebra initiatives we're doing. So, Mark, if you can see my screen,
Mm-hmm.
Just I'll narrate it for our audience. It's I'm at chat.openai.com, and I can just say, write a poem about metabolic diseases,
Mm-hmm.
and including, if you want to give me one, give me like a favorite one that you want to include, maybe PKU or something like that.
Sure. Yeah, PKU. Why don't we go with PKU?
Okay, let's see what it says. And I'm just typing phenol ketone. Let's say PKU because I think it's able to differentiate generally. And again, full disclosure, I don't know what I'm doing this live with you, so I have no idea what's going to come out, but we'll see what it
Okay.
does. So I said, write a poem about metabolic diseases, including PKU. It says, metabolic diseases, oh, how do they do vex? PKU is one, so complex. A genetic disorder inherited at birth. It affects the body's metabolism from the day of one's birth.
Wow.
Phenylalanine is a problem. It can't be processed right. It builds up in the body, causing a fright. In babies, PKU can cause severe brain damage, but with proper treatment, such damage can be managed. Diet is key. Low in protein is the rule. Special formula and foods must be the fuel. For PKU patients, every meal must be planned to ensure their bodies function as they should, as best as they can. Metabolic disease is a burden to bear, but with proper care, a healthy life can be had without despair. PKU may be tough, but it can be managed with grace, allowing those affected to live a normal life with a smile on their face.
Jeez. So this is AI.
This was just generated by AI right now. So,
Well, please make sure this is forbidden from any genetic trainees because I want people to generate their own stuff. I don't want people getting it from the internet. But that's amazing. That's amazing, and it's accurate. That's great.
yeah, I mean, another example, I'm saying, write a USMLE style question about NGLY1 deficiency, right? We've
Right.
a feature on here, and we can just see what it does. So it'll write a question, and I think this is where, obviously this will change the game for content generation, and I think physicians, clinicians will hopefully be able to better use tools like this to take care of their patients, to make the diagnosis faster, et cetera. So anyways, I just wrote out a question and we can ask it, to write out the answer explanation and things like that too. So just thanks for humoring me as we go through this.
Yeah, that's quite remarkable.
Yeah, cool. Awesome. Let me go back to your story. So, you're obviously a teacher. You're very passionate about including the patient voice in your teaching. Can you give us an overview of kind of how you started doing that, and like what are some of your activities right now as far as educating medical students, fellows, current nurses, and others about genetic diseases and specifically rare diseases?
Well, so when I was at camp, I used to teach swimming. I loved to teach swimming. So and then it moved on, and I sort of grew up. And teaching, I find teaching is magical. It's the transfer of knowledge and excitement. And you really do see a light above somebody's head turn on, and they sort of get it, and they have this smile on their face. So I sort of run with that, and I'm not afraid to experiment. So back in 2007, when I was at Tufts, recognizing that there's a workforce shortage in metabolism, there are lots of centers that don't have an on-site metabolic geneticist. I started going out to 6 regional academic medical centers in the Northeast every month for a day. And I would discuss patients. I would bring patients to present their story. I would lead rounds about a general topic. And what I realized in those 4 years, that was a focus group to try any number of different innovative things. And some things worked beautifully and something bombed, but it was an opportunity to have a lot of fun. And so that has resulted in many different things that I'm doing. One is the North American Metabolic Academy. Again, that it's intense, and it would be intolerable if there wasn't a humorous side, or if we didn't create innovative learning formats. We have the faculty debate in front of the students, and they kind of go back and forth, and the students may change their mind, in terms of the topic, and that sort of pushes the faculty to try hard and try to influence the audience. We have a rare disease day speaker series with Rare New England. where this past year, we during Rare Disease Day season, so between January and March, we bring patients with rare diseases or parents to different medical venues around the region. And so we went out to 11 different centers, genetic counseling programs, medical centers, medical schools, and brought these patients to tell their story. And the audience is floored. They haven't heard this before. It gives them a new way of thinking about it. And families and patients feel empowered. If you ask patients what if they could change medicine, what they would say is, I wish more doctors knew about what I had. Why do I have to know more than they do all the time? And so it's an opportunity for them to teach. And so it empowers them, and that makes me feel good. We're doing right now a number of online courses for professionals who work in this area of medicine, metabolism. Doctors are trained in this area, but nurses are not, genetic counselors are not, dietitians are not. They go in, I mean, they're trained in their discipline, but they have no idea about metabolism. So I'm sort of helping to do some of the formal training, give them some of that background. And because they're already interested in the area because they're working in it, and I'm sort of giving them a better foundation of knowledge. We're running a number of things, a couple of things through VMP Genetics, because I believe that patients teach about disease a whole lot better than I do. I mean, I can talk about facts and I can even talk about cases, but patients tell stories. And storytelling is so incredibly powerful as a teaching tool. It's long after my lecture is over, if I've co-presented with a patient, a month later, they won't remember who I am, but they'll remember the patient and they'll remember the story that the patient told. And so that helps me a whole lot, because if the patient can get into their brain because of some human interest angle, then hopefully some of the stuff that I teach about will get sucked in with it. And so since 2007, I've been teaching at Tufts Medical School and Boston University Medical School, not in genetics, but in biochemistry, because biochemistry is kind of dry. And but if you bring a patient in to talk about what happens if one of those chemical pathways is defective, suddenly you're putting the human back in biochemistry. And so biochemistry is the direct clinical, metabolism is the direct clinical application of biochemistry. You show me a chemical pathway, and I'll introduce you to someone who lives with a defect in that pathway. And so these are the highest rated classes in those biochemistry courses. And so now we're building a national patient teacher registry of patients and family members who will talk to medical audiences. And that's on our VMP Genetics website. If anybody who's interested can go there, and you can sign up, and we'd love to have you. Right now, we have almost about 90 speakers representing about 30 different disorders. And when we've looked for those for these speakers, we came across all kinds of patient videos online. And these are patients or caregivers talking 3 minutes, 5 minutes, some 10 minutes about living with their condition. And, some videos not so good, but some are terrific educational tools, but nobody knows that they're there because anyway. So what we're doing is we're developing a catalog which we don't house the videos, but we have the links. So we find the videos, we're writing summaries of them and keeping them all in one place. So if anyone wants to find a video that's already out there on the internet, they can come to us. Right now we have about 45 different videos listed.
I love that. And again, very, very true to our even origin story at Osmosis, where we realized that the best way to learn, is to teach, but then the second best way to learn is through anchoring that content with real life examples. So putting patient videos right next to the USMLE questions, right next to the videos about explanations are really important. And I've already sent your link to a teammate named Lewis, who's doing a fantastic job sending out a zebra of the week as part of our year of the zebra, including just today we included it's not a metabolic disorder, but esophageal atresia.
Sure.
And we featured the video of a 3-year-old named Grayson, a workman, whose video is up there front and center, because it humanizes the condition, as you're saying, and it makes it more memorable. And for some people like yourself, when you were in residency, you meet a patient directly or through a video that changes the course of your life, and it makes you decide to focus in on that condition or that field, or whatever it may be.
Oh, so absolutely. It was that 2-year-old in second-year pediatric residency who made me think about metabolic acidosis, and she changed the direction of my career. I had planned to go into neonatology, but then she sent me with this question. I went to Boston. I love the clinic. And 35 years later, I'm doing metabolic disease.
It's amazing. So given how much work you do in rare disease and again, metabolic disease and biochemical education, what are some of the main opportunities and challenges you see for the space? We obviously covered a lot of it. We know that this is the 40th anniversary of the Orphan Drug Act. There's more diseases being discovered every year that affect 300 million plus patients worldwide. Like, where do you see kind of the low, not maybe low-hanging fruit, but the opportunities and the challenges as we go into like the next decade of the Orphan Drug Act, as an example?
Well, the opportunity is, as I said before, there's all kinds of treatment opportunities for biochemical disorders, and because of the Orphan Drug Act, it enables and supports pharmaceutical interest in developing treatments, and there is it becomes lucrative, and so many major pharmaceutical companies are interested in developing products for the rare disease community. That is absolutely terrific. And the treatments are getting better and better over time. So we're looking at messenger RNA treatments. We're looking at microbiome-based treatments. We're looking at gene therapy treatments. So there's incredible promise. The challenge to us is our workforce shortage. Is because there are not enough people going into this right now, that it's not only reducing access for patients, and if you don't have a diagnosis, you can't access treatment, but it's having a negative effect on the physicians on the clinicians who are actually treating, because the workloads are becoming overwhelming. So we're in this area of medicine, we're looking for ways to attract medical students and young professionals into this area of medicine. Perhaps something like a medical school loan repayment program, which, nothing attracts better than that. And so if people are willing to learn and work in the field for a set number of years, then we'll help them out.
Yeah, no, I love that. Love that concept. And I agree that the more people like you, physicians, providers, as well as patients, family members who we've had talking about rare disease, the more obvious it is that, the discoveries. So not only is working in this field extremely meaningful, because they get, for those patients and their family members who have those conditions, they're so grateful and so appreciative and so engaged generally, that like it's very meaningful to go and help them. Right. Relative, obviously, chronic diseases, diabetes, hypertension need help too. But like those are so common that oftentimes people aren't as engaged when they have those conditions as when they have a metabolic acidosis. But secondly, if you happen to discover something through a clinical trial or through bench research for that genetic condition or metabolic condition, that potential discovery could not only impact that community that has that condition or is affected by it, but more people beyond that. So like the classic example is familial hypercholesterolemia. Research on that led to the development of statins, which obviously has saved hundreds of millions of lives in more common cardiovascular conditions.
Right. No, agreed. I guess the other challenge is with the amazing things that we're doing here in North America or Western Europe or Australia or Japan, what we have to be thinking of is how do we help all the millions or billions beyond the ivory towers who live in countries and they have the same diseases, but they're in countries where there just aren't the resources. And are there ways of simplifying and reducing the costs so we make these amazing therapies available to them as well?
Absolutely. Yeah. Like a 1 in a million disease. We've had several people whose kids have had that on the podcast. In the US is only 330 people, but globally would be over 8,000 people. And so if we're able to reach them both through content translation and localization, so they get their diagnostic odysseys reduced, but then also get that 330 patient group up to a couple thousand, then the power of those clinical trials becomes much stronger for the development of these new drugs. So very important. Obviously, you're a great teacher. We're a teaching company. If you could snap your fingers and teach any group of people anything, and you already are, you're already doing a lot in teaching, but if you wanted Osmosis to develop a video or a course on something to teach any group of people, what would it be and why?
Well, I would love for you guys to develop a promotional video about the field of metabolic genetics to sell to young to medical students. Make it look exciting, make it look sexy. It is exciting. Most people, I would say most medical students, and certainly most postgraduate trainees have no idea who Mark Korson. I mean, not that Mark Korson, they don't know what a metabolic geneticist is. So you don't even know that this is an opportunity. There are students there who like biochemistry, but they never thought there's any clinical relevance. So if you could do that, I would be forever grateful.
We will take that under advisement. And the podcast starts with that. And obviously some of the things we're doing around the Year of the Zebra is with the hope of getting people excited about these fields and these specific conditions, for sure.
Thank you.
You began this interview articulately describing why you chose medicine over law. And I'm curious, what advice would you give? What additional things would you say to, say, a first-year medical student or a pre-nursing student about pursuing their careers in healthcare, given how much healthcare has changed since the last few years?
Well, that's a good question. What I would say is, what you do in school has nothing to do with what happens after school. That school, you just have to get through it, learn what you can. Most of your learning is going to occur on the outside. How you do in the classroom does not reflect on how you'll do with patients. So don't be dismayed with the work, with the challenges within the school environment. Just push through it because there's another world on the other side. So just be patient for that. 2, medicine is becoming increasingly complex and harsh and unfriendly, and medicine will consume you if you don't protect yourself. So actually, when I was a pediatric resident in Canada, there was a survey across the country to residents. What are the major factors that determine how good your teaching program was? Number 1 was how good your life was outside residency. So it wasn't the lectures, it wasn't the quality of the patient, the conferences, it wasn't how good the faculty were. It was something that was very practical and personal. So if you have to protect your personal life and protect it greedily. And because if you don't do that, at some point you're going to regret it, and it's going to impact how you like your career. And start that as early as you can.
Fantastic advice, really great advice. And kind of this is now an increasingly personal question I ask because even when I spoke to you last, Mark, and many of our podcast guests, I hadn't yet made the decision to return and finish medical school, but I will be going back to Hopkins later this year to finish med school. So I'm personally intrigued by the answers that you and others have provided to that question.
Well, good luck.
Thank you. Okay, I know we're at time, so my last question for you is there anything else that you want our audience to know about you, VMP Genetics, metabolic disorders, or anything else in the space?
Well, we're always looking for people with good ideas, people who are interested in us. This patient community is so in need of friends and allies. If you have something that you would like to share or be part of or contribute, I'm always eager to hear. Some things are not practical, but let's see. Let's talk about it.
Awesome. We'll make sure people get in touch. And what is the best way for people to get in touch with you?
if you go to the VMP Genetics website, you can get in touch with me through the website. And once I hear from you, then I will write to you, and you'll have my email address and phone number and everything. So we'll be able to keep in contact.
Awesome. Well, I recommend our audience who's interested get involved, at least follow the links that you've provided, and hopefully they'll be writing some poems and stories about metabolic diseases soon enough. So, Mark, thanks so much for taking the time to be with us in the podcast, and more importantly, for the work that you've done to raise the line for so many people out there who've had rare and metabolic and genetic diseases.
It's been a pleasure speaking today, and thank you for all the good work you are doing and for raising awareness about rare disease.
Thank you so much. And with that, I'm Shiv Gaglani. Thank you to our audience for checking out today's show. And remember to do your part to raise the line and strengthen our healthcare system. We're all in this together. Take care.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisetheline podcast.